Well, a Tulsa woman looking for answers tonight. The nursing home caring for her mother still hasn't gotten the COVID-19 vaccine. Cases across the state continue to rise. Today, the state health department reporting more than 3,200 new cases of COVID-19, with 48 new deaths. Of those, 16 here in Tulsa County. Now, this daughter is worried her mother could get the virus before she's inoculated. 2 Works for You's Brady Halbleib joins us live in the studio with her concerns on the state's rollout plan. Brady?
Aaron, thank you. For Judy Thompson, it's been more than 9 months since she's been able to hug her mother, who currently lives at Baptist Village of Owasso. She's visited a few times while social distancing, but she says it's just not the same. Now she fears her 89-year-old mother could contract the virus before she gets her first dose of the vaccine.
It's extremely frustrating. I felt like I wanted to bust out crying yesterday.
Every day that passes brings more risk to Judy Thompson's mother as she waits for the arrival of a COVID-19 vaccine.
Usually if one person's concerned about something, there's a whole lot of others out there that are concerned about the same thing.
For Judy, the vaccine is a chance to reunite with her 89-year-old mother, who is currently suffering from other medical conditions.
And I'm so afraid that something's going to happen before, right at the end here. And that would just be so sad.
Phase 1 of the state's vaccine plan puts nursing homes and assisted living residents at the top of the list. CVS and Walgreens aiding the vaccination process by being responsible for administering the first doses of those vaccines. Still, it's not clear when and where her mother will get the vaccine.
A circle of not being able to find out anything.
She says she called the State Department of Health, the governor's office, and the Tulsa Health Department. She says she didn't get a clear answer for why there's a delay in vaccinations, but we were sent a statement. At this time, we have started to administer the vaccine to some priority groups within phase 2, such as first responders and outpatient healthcare workers. However, it's important to remember the phases are not linear, and this does not mean that phase 1 is complete. Vaccine doses remain limited at this time.
They need to move up on their list and get out there and get it done.
Meanwhile, for the rest of phase 1 and into phase 2, OU Chief Medical Officer Dr. Dale Bratzler says it could take weeks before the majority of priority groups get the opportunity to get vaccinated.
We're just not there yet, but I don't think it's going to be too long before you start hearing specific advertisements about how to go about finding a place to get the vaccine if you're a high-risk person.
Now, we've reached out to both Baptist Village and CVS and Walgreens for whether they have a contract with one another for those vaccines, but we have not heard back from either one of them. Brady Halbleib, 2 Works for You.